Andrew, hello again. We are back. This is episode 2, and it would seem sensible to very much pick up where we left off with episode 1. So episode 1 was a fantastic discussion, I think, about medication, about all things connected to medication. But we touched on it when at the very start of your slides, there was this phrase, particularly for adults, and I think with children as well, of a multimodal approach, where it's not just medication. These things are not panaceas. They're part of. So today, I think it's wise that we talk about everything else that we see, we hear, that we've got either written evidence or even anecdotal evidence of people looking towards to support them. And I think this will raise some very interesting questions. So let's start with a broad one for you.
Okay.
What are your thoughts on that then? So if we put meds to one side, we've done meds. Why is multimodal so important from your point of view?
Well, we did touch on this last week in thinking about whether ADHD is a low dopamine disorder or something else. And, you know, that sort of headline, ADHD is not a low dopamine disorder, I think we probably should flesh that out a bit more and think about that. And I think your experience as a mentor comes in here as well. It's not going to be so much about me showing slides and talking people through science. It's actually going to be us talking about how we work with people with ADHD. I hope, anyway.
Yeah, okay, I'll put my slides away then. Yeah, I have the slide deck ready. I won't use those then, that's fine.
Yeah, we won't always be turned into slides, but sometimes a visual representation really helps. But I think sometimes a good conversation with two people who are passionate about what they do and how they help people make progress in their life, hopefully will stimulate some thought for some people. Because a diagnosis of ADHD it's a point in time, isn't it? And it's a point of change. But it doesn't happen in isolation. We don't suddenly regenerate like Doctor Who into somebody else. No, absolutely not. No. We carry with us all of our life experience of everything that comes with undiagnosed ADHD and that missed opportunities, the whole reaction to being given a diagnosis, which for every individual person I've ever given a diagnosis to has been different, unique, and usually in response to their experience of living not knowing that their inattention and hyperactivity could be explained in terms of a clinical diagnosis. But I think there's so much more to understanding ADHD than the clinical diagnosis brings. We've talked about emotional dysregulation and how that's woven in and out of the diagnostic criteria. And that's very much a topic that comes up in clinic for me. People talking about, that was asked this yesterday, what about my emotions? Is there going to be any impact on that? So I think we need to bear in mind that there are different models, different ways of seeing ADHD. And I think where we fall down is thinking one of those is right. And I think the NICE guidelines, NICE because it's an acronym, not because they're nice. Talking about this multimodal approach is as close as we get in guidance to saying that we need more than one approach. You see this across psychiatry. It's not a unique phenomenon to ADHD. It's why we have occupational therapists, speech and language therapists. There are a range of professionals that bring different perspectives to the situation, and that in combination leads to the best outcomes. You look at studies that compare, throughout psychiatry, there's medication only or medication plus a talking therapy, and usually what happens is the medication plus a talking therapy comes out more strongly in effect than the medication on its own, and there's a reason for that, and I don't think that's peculiar to ADHD, but I think we need to learn from our understanding and our various different perspectives that we need those perspectives, that no one person has all of the answers.
Yes,
that it's not possible. It's not possible for one person to say, I know the way and it is this way. We can share information, and I think that's what this podcast is about. It's about giving people points to move on from, and ways of thinking differently about the information that's out there, to maximize the chances of being the best that we can be. That's I think that's the aim of all psychiatrists, nurses, coaches, mentors, therapists. You know, there are so many different perspectives that are trying to do something, and they all take their own approach. And if we, as the subject of those, can draw on all of those, that's what the guidelines are saying, is that we need to draw on all of those to get the best outcomes, and that's there across mental health literature from the very beginning.
Yeah. So you've raised already some points here, haven't you? I mean, the one thing that's rattling around my head now is there's no one answer. Nobody has the answer, because if there was the answer, much like a phrase you used last week about if it was just dopamine, the meds would be more effective. If there was one answer, everyone could just follow it and we'd all have a massive change and it would be the same for everyone. But that isn't the reality of ADHD, because your ADHD on a good day will look completely different to mine on a good day, and mine on a bad day will look completely different to yours. And so there can't be a singular answer, can there?
No, there can't. And it's a shortcoming of the medical model, I think, that medicine tends to reduce complexity down to its simplest form. And it's the secret of medicine's success is by making things more simple, we can intervene with them. Yeah. So it's not in medicine's interests to think of ADHD as something that is so profoundly impacting on all aspects of life. Yes, we talk in the diagnostic criteria about severe functional impairment, but there's a large amount of subjectivity in that concept. You know, what is a functional impairment? It's horrible language to start with. That's one. But when you move past that horrible language, actually, what does that mean? Does that mean that there is a standard, a normal that we all sort of aspire to or think to, or actually is this a relative term? This idea of being impaired. And medicine is quite seductive in thinking that it's an absolute term. You know, if you've got an infection, you take an antibiotic, and we know that the antibiotic kills the infection. It kills the bacteria that are causing that infection. It's not the same in psychiatry. We change perspectives. You know, it's the glasses thing. I know you've been adjusting to your varifocals all week, and you know you change the way you see through your eyes by putting these lenses in front, and that brings you closer to typical sight. And that's what's happening with ADHD medications, and that really when we've achieved an optimal dose of medication, that's when the work begins. And probably that's sort of more music to your ears, because the clinical amongst us would be sort of thinking, oh well, we've done a good job, we found an optimal medication regime, and actually that is only the start point, because then we've achieved as much as we can do with the medicine. That sets the scene for us to then evolve a new way of living, and that comes with many challenges, even if that treatment response with medication is perfect and that rarely happens. It can happen, but it rarely happens. But even if we see marked improvements in attention, reduced hyperactivity, that's an awful lot of change to be dealing with.
Isn't it?
And how do we deal with that? Because there isn't a tablet for that. There isn't a tablet for making change comfortable. Change is inherently difficult because we like familiar. I think as humans, not as the neurodivergent population. Actually, humans like routine. They like familiar. They like to not have the unexpected. And then we come along with these really effective medicines that lead to the unexpected and lead to this shift in focus. It's not an enhancement of focus, it's a shift in focus. And how do we help people deal with that?
Yeah, it's a really, I'm just sat here listening to you and so many things are popping up into my head. I love the glasses analogy, but let's be honest, it's why I've got these and I've already been told, come back and see us in 2 years because you'll probably need to change your prescription. And yet, how many of us seem to think at the beginning, right, once I'm on that optimal dose, that's it, done for life, just do that. And never think about it again. Well, it in simple terms, it can't be that straightforward, can it? Because what happens if you have a major life change? What happens if you have a major emotional disturbance or a global phenomenon? Let's say COVID strikes again. How many people came to their understanding of their ADHD because we were all locked up in lockdown, right? So we can't just assume that because psychiatry has done its job, there you are, there's your 60 mil, there's your 80 mil, your whatever, that's the end of it. And I think, yes, while there are other approaches even like coaching, mentoring, etc., that can and should, I think, step in at a certain point, I think it's a much more sensible approach to start the conversation being wider about it's never done. This isn't a fix. Like you said last week, it's not put a plaster on it. It's not putting your arm in a cast because you've got a broken elbow, leave it for 12 weeks and then it's healed again. It changes. We change. Life changes. Therefore, how our ADHD impacts on our behaviour, our concentration, etc., is going to change. So when you're asked in clinic, what about my emotions? I think that's a very valid and actually a very astute question for that part of the process, because I think most people, me included, ask a much broader question, which is, will this change me? And the answer should be, as we said, I think last week, yes. Yes, it will. And I don't know how. And I can't tell you whether it will be for the better or not at this point, because we've got to find out. And the only person that's got the real evidence on that will be you. And I think that's quite scary as well, because it doesn't go along with the medical approach as most of us think. We are putting a pill in our mouth. Oh, well done. It's not, is it? It's not.
No, it's not. No, it's that sort of critique of those 4 letters, isn't it? And that last D, is it really a disorder as we understand disorder, and what does that mean? You know, and that word disorder means different things to different people. It does. You know, is that infection that's treated with antibiotics a bacterial disorder?
Yeah.
That, you know, we've got all these preconceptions about what medicine should bring. And I think psychiatry over the last 40 years that I've been aware of psychiatry has evolved in that sense, and that there has been a broadening of understanding that we do need to take different approaches, and there isn't a one-size-fits-all like a throat infection. You know, you could go to the GP and say, I've got a throat infection, and say, oh, I know exactly what to give you for that. It's not like that in psychiatry, because psychiatry is about who we are and how we are, as well as our physical form, the biology in our brains. So last week we talked a lot about biology in our brains, and I said it's not a dopamine disorder. Well, of course, there's dysregulation of dopamine in ADHD. We see it on fMRI, but that is really reducing the human experience to say that that's all it is. It's ADHD diagnosis is a recognition of a lifetime of struggle, a lifetime of hiding things, and that doesn't go away because we dial up someone's focus and concentration with dopamine,
right? So you've hit that on the head.
But we see improvements in people's ability to focus, concentrate, not be so overactive as a result of the medication. But that's a really reductionist perception of what ADHD is. My life as someone with ADHD is predominantly being someone who doesn't know he's got ADHD. So I've learned lots of things about me in a social context, thinking I've had one type of brain and I have a very different type of brain. So is it any wonder that there were times when I struggled?
No, and I think the question that's popping to my head on that point is going back slightly, that it's not as straightforward or as simple as it's just a dopamine deficiency. That's not all that's at play here. And whilst, it plays its part, do you think this is part of the reason why there can be so much confusion in the beginning? Because if that's what we're hearing, if that's what we're being presented so commonly, like we spoke about last week, it's this, and actually the information isn't as broad as it needs to be, and it doesn't prepare us for everything that living with that diagnosis of those 4 letters may mean, that our expectations aren't grounded in what should be reality. Our expectations are too focused on, well, if my concentration improves, I'm fine. And actually, no, we've just improved your attention and concentration.
It's exactly that. The medical model has to reduce complex problems down to things that can have an intervention made. And that's across the board. That's not just in psychiatry. That's what medicine does. A knee surgeon doesn't give a great deal of consideration to the impact of having a sore knee that led to needing that surgery. Their concern is making sure that they join to the bones and that the surgery is without infection and all of those sorts of things. They've enough to be dealing with just with that, without thinking about how I was before they put that knee in and what's going to happen afterwards. That's for the physiotherapist to deal with. So there are different roles at different steps along the journey, and I don't think it's right to be wholly critical of the medical model. It has its place, but it's quite seductive for us to think, because of all our human experience of medicine, that is going to be the whole answer, and it just can't be. It just can't be, because yes, we're not robots with dials on our heads that can turn up dopamine, and there are things that we can do that will enhance dopamine transmission without taking stimulant drugs or non-stimulant ADHD treatments. We've talked about some of those before. We'll talk about more today. But that is a really important part of the journey of making sense of this difference that is being diagnosed. And I do think it's often missed. It's often missed because the medications are so powerful and they really work.
Okay. So I've got a couple of questions on the medication based on conversations I see quite frequently and have with people. The first thing I'll ask you is this: as a clinician, professionally speaking now, if you had to plot a diagram, should we say, of where different support mechanisms, tools may fit in the process. So, and I'm talking maybe from a diagnosis through to whenever that is for anyone, they feel like they've got some kind of a handle on their ADHD. If we were to say that it logically would start with a clinical intervention, an assessment, a diagnosis, in your practice, what's next for you? What would you typically be recommending? Because I've heard stories of people who were diagnosed 20 years ago, 30 years ago, and 3 months ago. And what they're told after that initial, yes, it's ADHD, varies so wildly from, here's a book I recommend you go and buy, to there's your prescription, to here's a list of YouTubers. And I sort of understand the intentions there, but I wonder what your thoughts are on that. And what do you recommend?
Okay. You asked me to answer that as a clinician, so I'll answer it first as a clinician, and then I'll answer it as a nurse, and then I'll answer it as a human being. So as a clinician, nice guidance tells us first thing you do with an adult who's diagnosed with ADHD is give medication. Why do they say that? Because it is by far the most profound impact that you can have. More bang for the buck. Yeah, you give a medication, we see attention improve, we see hyperactivity reduce. And by removing those core symptoms or reducing those core symptoms, we see quality of life improve. And we do. I've done observational studies in clinics about that, and we do see that. And if you're new to treatment, you're more likely to see a stronger response than if, say, you were treated as a child, had a break, and then come back as an adult. Those people don't tend not to see as much of an improvement in quality of life. What can be missing in that journey is the context. So what I try to do as a nurse is to explore the history, to explain how the coexisting conditions, because more adults with ADHD have a coexisting condition than don't, how do they weave in? Where does that anxiety come from? How did it start? So in summing up a diagnosis, most of us will have stories about the onset of anxiety in our teenage years. Yeah. So as we become more socially aware, we worry what people think about us, and we contain that hyperactivity. We contain the visible signs of ADHD. And by holding that in, instead of expressing it and running around the schoolyard in primary school, by holding it in and not letting people see, we sort of build up this internal tension which manifests as anxiety. And often helping people put into context their life story, I find, helps set the scene for the onset of medicines working. And I'm not sure how many clinicians do that, but for me, in my journey of understanding ADHD and the reading I've done around ADHD, I think it's important that we respect who we've been when we start making an intervention to change. Because the medical model tells us that it's a disorder, that it's a deficit, that all the language of things being missing. And there's so much more to it than that. And that comes from these other perspectives, which is why I'm answering the question as a nurse. Then, as a person, I do that because that's what I wanted. That's because it's the thinking I've done. It's the experience I've gained over the years of what people ask for, what people come back with at that second and third appointment as they're sort of adjusting to the impact of medication. And that's very much founded on a relationship. You have to have a working relationship. That's not something you can read on a computer screen. It's about a human connection and a dialogue. And the pressure in healthcare is to deliver time-limited interventions that produce an evidenced outcome, which is a valid thing. But there is evidence for providing that guidance, that coaching, that mentoring, that support. And I think probably we should go on to talk about that language, because people might not know the difference between a therapist, a coach, and a mentor.
Yeah, I think so. I'm wondering also whether this is an opportune moment, because you talk about time sensitive in terms of NHS, and you talk about the pressures, and so in the trailer for episode 1, obviously there was a short clip from the documentary that came out earlier this year, and that sparked a lot of conversation about what an appointment should look like. Now, just from your point of view, do you think that's been useful, that it's actually started conversation about what does a good appointment, or what should an appointment look like, as well as the aftercare?
As someone who spent many months working with the BBC on this, my initial reaction to that broadcast was, oh, we've missed a lot of what we explored. I was on there. I was on at the beginning and I was on at the end, maybe 10 seconds in total. And I was filming for 3 hours. And we talked about the intricacies of the economics of ADHD, for example. It wasn't mentioned because it doesn't make half an hour primetime television show. And I think that is the nub of the issue here, that often you just see the headlines, and that show was very much about a particular headline. And even in those 10 seconds that I contributed to what was broadcast, they cut off half of what I said. So they cut me mid-sentence. So I think you put it on the trailer last week. It was, on the hour, every hour. But what was cut off but that was 2 years ago. I don't know how they operate now. But that phrase was removed. And I'm sure that, I know, because at the World Federation conference, there were tensions, shall we say. The ADHD 360 will be upset by that. But that was my experience 2 years ago when I was working there, that I went in at 9 o'clock and I saw 3 people, had a lunch break, and then I saw 3 people in the afternoon. And doing 6 diagnostic assessments in a day is not humanly possible, because I've tried it and it just can't be done. It's too much of an intense experience. I think the idea that an ADHD diagnosis can be reached in 45 minutes to an hour has been challenged, and that's been positive. But there were so many reactions to that program, and they were reactions by people who hold different perspectives, applying different models. And I think we need to think about all of those different approaches and what their place is. That actually we can't, and that's why I've joined you in this podcast and why Divergent support it, because I think, with you as an established mentor who makes good sense when you talk about living with ADHD. That sort of partnership working is so important. If we get into, your model's no good because it does this, or your model's no good because it does that, and it disrespects, that's not helpful. That doesn't progress the care of people with ADHD. It doesn't progress the lives of people with ADHD. There are elements in all the different perspectives that are valuable. There isn't one straightforward answer. But equally, you can't diagnose ADHD in 45 minutes, even with a huge sort of preamble of questionnaires, which most ADHD services do to try and at least get those basic facts across first. What information can you exchange in any conversation with a stranger in 45 minutes? You're certainly not going to know their whole life story and how those events impacted on their development, who they are. There are key events in my life that changed who I am. I reacted to them before I understood I had ADHD, and that's life. And we all need that guidance. We're social creatures. That's the human condition is to be social, to be connected. And those connections can bring tensions, and it's how we manage those tensions that sets us apart.
Yeah.
So I think, there are lots of different perspectives, and people bring different parts of value to different people's stories. What one person's solution is another person's nightmare. I think I said that last week as well.
But you're right.
It's not straightforward. It's a personal journey. And as a clinician, I come in with medications, and that has the most profound effect in the short term. But that, if that doesn't have meaning in someone's life, then they're probably not going to continue to take the medicines.
No.
And I think a lot of people do sort of disengage with ADHD healthcare because there isn't that meaning. There's just, here's a drug that boosts your attention. What does that mean to me? What does that mean to 14-year-old me sitting gazing out the history teacher's window rather than listening to what he was saying about Hitler? It doesn't mean anything, and it's got to be part of a journey. So I think a lot of the talking supports and therapies have a very important place in cementing the revelation that there's this diagnosis. I do think so. I speak at there's an annual nurses conference about ADHD, and I usually speak at that. And this year, I spoke about what it is to be an ADHD nurse and how we can use our skills to improve care. No, ADHD's taken my train.
No, well, that's important to me. Here's something I think is interesting in what you said. You used the phrase, some people disengage with healthcare in terms of ADHD. Now, this is a conversation I see quite a lot, and typically people on this side of the fence I'm about to mention are incredibly passionate about this. And it's one of a few options. Either they believe that their ADHD isn't quote unquote severe bad enough to warrant medication. Okay. They have preconceived ideas and notions about what medication may do, which comes back to that question of what have you been told in the first place, but they are fearful and don't engage. Or what I seem to see is they started medication, very often maybe didn't even complete titration because they didn't get the profound effects that they thought, whatever that was. And I wonder whether the perception of what that might be was realistic. And then disengage. Now, typically, in amongst those three groups, they are the people who then are very evangelistic, very passionate about the other things that they do that help them. And I think it's really important to bring that up now, because in context, what they're actually doing is right. They're looking for alternatives. They're looking for different ways to support themselves, whether it's through their hobbies or exercise or meditation, or we'll touch on lots of things. Looking for those things is important. But what always concerns me is that it seems to be that they are diametrically opposed to the concept of medication. I have been told nobody needs to take medication. Oh, medication's a scam. No, I was actually told online a few weeks ago, there is no such thing as medication for ADHD, which took me a while to process because I kind of looked at my bottle of pills and went, that's a really good magic trick then, because I don't know what that is, right? But I sort of get it. This is somebody who's found their alternate path and believes that, oh, well, that's not necessary. Now, again, put whichever hat on you want to answer this one, I suppose. Do you think that people end up more in that camp that are so opposed? Because again, like we've said, perhaps the information to begin with wasn't clear enough. The expectations weren't right.
There's a number of reasons. As with all of this, it's multifaceted, and yes, there is that element of if the medication isn't set up, the expectations aren't set up correctly, then when it doesn't do whatever the person expected, and it does what it's going to do, because that's what happens. You get this sort of, oh, that's not what I wanted it to be. You know, if you think ADHD is like a sore throat and you take some stimulants and it goes away, then you're going to be disappointed by the effects of medication. But there's another group as well, Matt, and that is the group who, in all good faith, engage in services, work with services, and encounter endless barriers. So the configuration of services, how those services are delivered, has a profound effect on whether people continue to use them. The best example I can give is people being discharged for missing 2 appointments. So your standard in NHS provision is if you miss 2 appointments, you won't get a third. That's across the board. Dentists, it's a response. But given our symptom cluster, you would think that the people designing these services, and I've been one of those, would say, actually, we need a bit of wiggle room here. We need a little bit of flexibility. You know, it's like building a lab that builds wheelchairs on the top floor of the tower. You know, if the service is configured such that you can't use it, then you're not going to use it. No. If just as much as if the medication is set up to be something it isn't, then you're going to say, well, that doesn't do what you said it would do. So, you know, people vote with their feet. They do with what they use. We use what we feel is effective for us. But if you don't know what to expect, then you often will be disappointed. And that's not, you know, that's life, isn't it? If you know what's coming, you're much less likely to be disappointed when it happens.
Yeah, I think you're right, and it's interesting you say being discharged after 2 appointments. Mike, I'm just
there were so many structural barriers like that. You know, I could give you a list of examples of that sort of thing, but where barriers are put in place, structural barriers are put in place that are aligned so closely to the difficulties that they're alleging to support. You know, it's like often in schools you'll see a whole list of things that can get you in detention or on a report card. One school I went into, they had a list of 10. If you do this, you'll be in detention. If you do that, you'll be on report. Of those 10 things, 9 of them were core symptoms of ADHD.
Oh wow! May as well just sign up for a weekly detention then. Yeah.
And that is why ADHD isn't just a low dopamine disorder. The disability is about how society sort of responds to those challenges as well. That's improving. You know, the diversity agenda is improving, and it's improving things, and that understanding that we are different, and we should celebrate that rather than all aim to be the same. You know, that's a shift. That's a culture shift across our lives, isn't it? You know, it was very much when I was at school. You're going to be this. You go for this, and kids are still getting taught that now. You know, you've got to get above this grade in GCSE if you want to have any chance of a positive life. Well, not necessarily. I can resit. You know, there are all sorts of ways around, but you're somehow deficient if you don't leave school at 16 with this clutch of GCSEs above a grade 4, and that's not the case. Often people leave school without those. They leave school without those grades because the school system was deficient.
Yeah. Well, my youngest son is a prime example of that. He's 17. Was home educated for 4.5 years because infant junior school just didn't work for him. Excuse my phone going off. That should have been on silent. That was professional. Because school didn't work for him. And then went back to school in year 10, suffered terribly again with bullying, was at college for a year doing animal care and seemingly doing well. And then as his anxiety grew this year, lasted all of, I think, 6 weeks at college before Catherine, my wife, and I spoke with him and said, I don't think college is set up for you. It's not that you want to be here, but this college can't actually support you because we describe him as part of the missing middle. He doesn't present extremely enough one way or the other. Autism or ADHD. He's just a challenge. They don't know how to deal with him and he gets overwhelmed. So here we are with a 17-year-old, pulled out of college, home educated again, start questioning what it means and is it his ADHD and everything. And in a very random conversation, he's a typical 17-year-old for a lot. He's a gamer, up in his room now, gaming. Doesn't want to design games, doesn't want to make games, doesn't want to code games, plays them for his friends, but he will talk about them endlessly. And I mean, like most people, hyperfixate endlessly. And he was talking to us about the Game Awards coming up, and he was very passionate. And I just happened to say, you make a great journalist. This is gaming journalism. This is using what you're good at, this passion, to inform other people. Within 4 hours, he'd secured his first interview with somebody who'd just got a world record speed run on a platform game, which he's currently editing to publish with the developers of the game. And I take great comfort in that and pride because he's a prime example of the education system isn't set up for him. It's not that he's not clever or bright or passionate or able. It's that the system didn't allow him to feel those things or display those things. Sat in his bedroom, getting an interview, publishing it, and he's beaming again. And I think this is that part of the conversation you spoke about. We have to remember our history when we come to diagnosis. We have to remember who we've been, because who we are might be slightly different, but it's important. So therapies then, or not therapies, that's the wrong word, alternatives. So if we put the medication and the clinical side, we see lots of people services, alternative provision for those of us with ADHD designed to help. Now, chief amongst them is probably ADHD coaching. There are lots of different coaches out there, and I think we need to have a bit of a touch point on what is coaching, why is it known to work, what's it rooted in. Same thing goes for sort of what I do in terms of mentoring and why perhaps is that different. And then we've got things like, what about counselling? What about therapy? Where might that fit into it? So if we start maybe with the more, and dare I use that phrase again, clinical of the four, if we start with, say, therapy, in your experience of the clients you've worked with, when is it you feel therapy is something that's worth exploring and why?
It's about thinking what therapy is, really, isn't it? It's thinking about that path rather than a different path. So therapy is looking back into that journey that you've had and looking at the challenges and the harms that have been done as a result of, if it's going to be an ADHD focused therapy, as a result of the challenges that you met because of inattention and hyperactivity and impulsivity, and how that shaped your development. That's what therapy is about. It's about exploring how you reacted to things, and deciding with the benefit of hindsight whether or not that was how you would react now.
Right.
That's the journey of therapy, is recontextualizing with the benefit of hindsight. I think that's, reasonable sort of explanation of what therapy is. But there are a range of models. So cognitive behavioral therapy gets a lot of text in the guidance, which probably comes from the spread of cognitive behavioral therapy in addressing things like anxiety and depression, those common mental health problems. So we've got this experience as a society that going to a cognitive behavioral therapist and changing the way you think will change the way you feel. That's what cognitive behavioral therapy is. If you challenge those automatic thoughts, those assumptions that are at the core of who you are because of what you've been through, you can change how you feel. And feel stronger. So that's what cognitive behavioral therapy brings. As a clinician, I always prefer people to do that after medication, if they're going to have medication, because if your thoughts are diffuse and you're distractible, you're going to find it more difficult to use your thoughts to regulate your emotions. So by first stabilizing the inattention, we then set the foundation to build and reflect on that journey that you've been through. And in a good ADHD clinic, there'll be an element of that. I've already hinted towards an element of that in setting the scene and expectations for medication. Yeah. It's a kind of it is a kind of cognitive behavioral intervention in that it's changing the understanding to impact on the emotional response to whatever changes. So that's sort of what the guidance sort of sets as the gold standard for therapy. But there are other therapies as well, and it goes. The idea of using those goes back to the idea that we are not ADHD. We are someone whose cognition can be characterized by those four letters.
Yeah.
But those four letters don't happen in isolation, that we have developmental experiences. You hear a lot about trauma and growing up with a neurodivergence. Well, yeah, damn right it's traumatic, because you think you're one thing and you're another thing. So sometimes something like an integrative psychotherapy, where you go back to the child and you nurture the child, can be really helpful, because the child made childish and incorrect assumptions about who they were and how they were, without that understanding that there was this difficulty that 5% of the population have. So going back and unpacking that and looking after the child that got left behind, the child that said, oh, well, if you think I'm going to be that guy, then I might as well be that guy, because you treat me like that whether I'm behaving that way or not. So, I'm just going to live up to the play to the role. See that a lot in clinic. A lot of young men sort of come to us it's having exactly that story. So there's, psychotherapeutic interventions can help with the trauma that's caused as a result of growing up with that difference and not knowing, and nobody around you knowing. Counselling, counselling's less directive. So things like integrative psychotherapy and cognitive behavioural therapy use a particular model, a particular understanding of how our thoughts, feelings, and actions relate to one another. Whereas counselling is a bit different. So counselling tends to be non-directive. There isn't sort of an underpinning model that you guide someone through. If you change this thought, then this feeling will happen. It's a more exploratory, sort of walking alongside someone to ask pointed questions, to guide someone to their own revelations about what's going on and their experiences. So those are the therapies, the talking therapies as such, and then I suppose we can move on to sort of the more supportive, structured things that probably you're more of an expert on than I am.
Yeah, it's an interesting one. So, I mean, chief amongst the two, I suppose, are these two words that we'll hear: coaching and mentoring. So, and I'll put this sort of link or a link to this information in the description. Broadly speaking, the definition of mentoring is someone who shares their knowledge, skills, and or experience to help another develop and grow. And a coach is someone who provides guidance to someone on their goals and helps them reach their full potential. Now, if you take those two statements as they read and think about them in terms of ADHD, I think it's a really interesting difference, and it's an important difference. I see lots of people who take the services of a coach on board, who are professionals. They're in a professional world. They're already in the workplace. And their ADHD, the challenges their ADHD presents, they feel is holding them back, is making, whether it's progression or promotion or being taken seriously, whatever it may be, difficult or a challenge. So they seek the services of a coach, typically someone who, and some of the best coaches that I know of are people who've come from a business background, who've done other styles of coaching, who've trained as professional coaches and had a breadth of experience in coaching, who typically have then, like us sat here now, come to their own realization that they have ADHD and are then able to study ADHD and layer on what it means to think and behave in an ADHD way onto their coaching knowledge and sort of intertwine them so that when person A says, I'm struggling with all the challenges presented by my executive function in the workplace, and I think it's holding me back, they've got that business experience of, well, what does that mean in the workplace? Who's that going to affect? And also, here are some strategies, some tools, some techniques that typically are proven to have helped other people. And a good coach, I think a lot of people have said this to me in the past, a good coach and a good mentor never tells. They help guide. So typically we know our answers. Sometimes we just need help. So I think a good coach for me, and as I say, the ones I know have done several things in their past. So they've got experience professionally in the workplace. So if they're talking about supporting people in the workplace, they've coached in the workplace, okay? Or they've coached in some kind of a professional capacity. And then in terms of their ADHD and other knowledge, what they've done is spent some time during their own journey of understanding of ADHD, learning, researching, working with lots of other people who also have ADHD to understand what shifts in their current thinking, in their models they may have used in the past, they might need to apply. Because it's fair to say the standard models of coaching might not work for somebody having a particularly bad ADHD day, week, month. We can then take that a step further, and there are coaches now, executive coaches and executive ADHD coaches, who are women who specialize in working with women. And again, this is a topic we'll do separately, women who are perimenopausal and menopausal. And so they've got that extra layer of understanding of, okay, during your monthly cycle, how does this change your ADHD? And therefore, how does that impact your work? So coaching as a model, as a tool, if you like, I think is incredibly valuable when the person has the experience to deliver it confidently.
So let me clarify something.
Yeah, go for it.
My turn to ask you questions now.
Go for it.
So it seems like what you've just said is coaching is almost like the counselling of the talking therapies. You know, that it's at the softer end, it's inductive, it draws out the strengths that someone has and builds on those, and a coach will bring in their experience. Is that right?
Maybe mentoring more fits that. For me, mentoring is softer, if to use that terminology. I think coaching tends to have, if you've been professionally trained as a coach. So the difference is you can study coaching, you can be professionally certified, and you can have accreditations as a coach through ADCA or various other institutions as a business coach. That doesn't exist for mentoring. Mentoring is, in this world, particularly ADHD, it's softer. It's more, suppose the way I describe it when I talk to my clients is it's based on my experience, which I'll touch on in a minute. But coaching has more guiding principles in place, which are, I suppose, a bit like where you talk about therapies leaning towards cognitive behavioral therapy or dialectical behavior therapy, different models. Coaching tends to have those kind of frameworks to draw upon, which then help people achieve those goals in particular. Where mentoring differs for me, and whenever I speak to a new client, what I try and explain to them is, I can't tell you anything. I can't tell you how to do, how to feel, how to change anything. A, I don't have the right, and B, they're not my answers to have. But because I have been unofficially, and by unofficially I mean without being paid, mentoring people since about 2005, there's this breadth of experience and conversations I've had over those years of listening to other people, working with other people in lots of different scenarios, adults, children, professionals, out of work, in work. And I now work with people going through recovery and addiction and all sorts of different sort of areas. I can hear what they say and I'm able to say, but I've come across something similar to that before. I've heard someone else going through that, but I've gone through that before, similar. And here's what I'm hearing. Am I right? And here's what I know worked in the past for me or someone else. And I often describe it as, when I'm in a session, I give people sort of tools to try while I'm with them. If you were to try X in that situation, how would it feel? What do you think might happen? No? Okay, what about Y? And I let them sort of model things with me in the safety of a session before they decide, okay, I'll go away and try that. And I think that's important, because what I notice as a mentor is a lot of the questions I get are initially, is it just me? Does everyone do this? And how do I make this stop? But those are sort of the most common things, these frustration-based. It's driving me mad, or it's driving my partner mad, or I'm struggling with this. What I'm able to do is, a lot of it initially is empathy. I always think I've done my job well if somebody says, I actually feel heard. I feel like I've been heard, and a good coach should feel, I feel like I have been validated. This isn't just me. The next step for me in mentoring is, great, now you feel that you're not on your own and it's not just you. How can we now give you some empowerment or some agency over what to do next? Now, sometimes that's, how do you talk to other people? Sometimes that's, how do you talk to yourself? Right? It's what are you saying to yourself about your ADHD? What are you thinking when you wake up and get out of bed? And then we'll cover all the usual topics of why don't I sleep very well? Why don't I exercise? Why don't I do? Is it just me? For me, mentoring is listening, sharing experience, and 90% of it is helping people feel heard. And them coming to the point of, do you know what? I needed to talk that out loud with someone I trust gets it, who's not going to judge me, who's not going to judge my ADHD or say, well, that's because, to then feel comfortable with an answer. So mentoring is, I think, the softer of the two. But again, I still had massive imposter syndrome about charging for mentoring and amongst everything else I do, because ultimately it's a lot of responsibility. I'm taking people's money off them. We're in a cost of living crisis, as we're told. And so I've got a responsibility to be upfront. If I don't think I should or can work with somebody, I'll tell them. If I think, look, we're not getting anywhere, I will say, I think this is maybe not my area of expertise. This sounds more like coaching. It sounds more like counselling. It sounds more like therapy even, which I've done. because there are occasions where I'm kind of, this is getting out of my remit. It wouldn't be very ethical for me to carry on taking your money to do this, but I'm here if you decide to, and when you come back. Does that make sense? It's that thing of, I want it to work for everyone. I'm not in it to make money and just run.
Do you know that a lot of what you've just said, I was thinking, Matt, that's just what a good nurse would do, given the time. I've talked about weaving in some of that in setting expectations and managing response in clinic when looking at medication. But actually, a lot of what you were saying there resonated with me. And as you were talking, I was thinking, but Matt, that's what a good nurse does. That's what a good psychiatrist should do. So there's something about what a good something is, a good therapeutic support, a good ally, really, isn't it? It's about being an ally. It's about being, irrespective of which model you adopt, it's feeling that there's a connection, that someone is listening to you, that you're being heard, and that they're respecting your experience. So as the service user, I suppose is probably the best coverall name. So there are themes for all. There are different models. This conversation seems to be leading me to the idea that there is something that we can say that defines what a good ADHD supporter is. And I very much agree with what you say about it. It's 90% feeling heard. The problems that I've encountered in my practice are where people have felt I haven't listened.
Yeah. Absolutely.
And I'm sure it's the same for you. Where that relationship breaks down, for the best of intentions, we've tried to listen and it's gone wrong. We've made an assumption somewhere and left someone behind. Yeah. And whether that's coaching, counselling, CBT, prescribing a medication, there's something about feeling heard and not left behind, that you're actually an active partner in the work that's being done, that is so important.
It is, and I think also from the softer skills side, so the mentoring and coaching, I think for me, I started with the mindset that I know I'm not going to work with people forever. Some people might have one session, some people might have 10 sessions, some people might have fewer or more. That's up to them. And when I'm asked, well, how many sessions do I need? I don't know. You'll know. You'll know when I'm not providing any more value to you. That's not for me to tell you. That's why, I don't sell in packages or buy a number of sessions. I don't think it's fair. You pay, you book, you have your session, you decide. But I think it's very important that this choice, or rather that choice, is purely in, and to use that term, the service user's hands.
Yes.
They know when something has worked. And typically it's when they walk out of the office or they hang up from that call and they think, yes, that helped. The day they think, I'm not sure. Maybe it's time to say, okay, I need to look for someone else. There is no harm in that. I don't take that, strangely, as somebody that suffers with, RSD, I never take that personally, because I know that that's logical. It makes sense to accept that.
It's almost an evolution, and it could be seen as a success, that someone's saying, you're not right for me anymore. I came to you because I thought you were right, and you have been right. Yeah. But now you're not. So something's changed that means that what I came to you originally for, you've actually resolved. And I may still have challenges, but you've met the brief that I set you.
I think,
and it's okay to say that's done.
You're right. But I think there's a question that I always ask, and I'm sure most do, but I think it's important at the start of working with somebody is, where are you in your journey so far? Are you waiting for assessment? Have you had a diagnosis? Are you in titration? Are you on a working dose? What have your experiences of that been so far? And I tend to always preface it by going, I'm not a clinician, but it's going to sound like I'm asking you very clinical questions, because I need to know where they are in that process. Is their dose doing what they thought it would do? And I ask that question. If they're taking meds, what was your expectation when you started? What's it doing for you now? Because I know that if I start with somebody on day one of them taking meds, in 3 weeks, they'll be presenting completely different. In 6 weeks, they'll be presenting completely different. And I will have different people in front of me, thinking, reacting, feeling differently, and probably asking different questions. So if I don't know that at the start, and I'm not always checking that information, and whether that, whether I'm a coach or a counsellor or a therapist, if that's not taken into account, we're missing vital information that this is fluid. This process of understanding ADHD changes.
So actually, it's the same as medication, actually.
It is.
You set out what you're hoping for, maybe have a rough idea of what the journey's going to be, or explore that journey together.
Yeah.
And then say, hey, we've arrived.
Yeah.
And that might not be, your ADHD is resolved, because that's not what we're aiming for. But there's something about whether you're a psychiatrist or a mentor. It's about setting the scene, setting the goals, making a plan, and getting to that point, and not saying when you reach that point, oh well, we've achieved everything we set out to, but actually we haven't succeeded.
No,
because there are still problems, because life changes. There are challenges along the way, and things like COVID happen, and So
you're right, and it goes back to, we said this at the start. I've had clients who've had major life events in the timescales that I've been working with them, and either it's a case of, let's pause for a while and you just deal with that, ADHD aside, you just go and deal with that, and when you're ready, come back, and then we'll see how you're thinking, feeling, what you need, and does it change? There's nuance to it. Interestingly, though, and I suppose this is a lead on, one of the things I know I get asked in mentoring an awful lot, and I know some of my friends who are coaches do, is, what else should I be doing to help my ADHD? What else can I do to help my ADHD? Which I always think is it's an interesting question. Right? You're sat there paying me money for me to give you an answer, and you want me to now tell you what else should you spend your money on particularly. So it does lead this thing into whether it's supplements or changing diet or talking about sleep, or these kind of questions crop up an awful lot. So I suppose what's interesting for me is I have a list of the things I hear day in, day out, week in, week out, that people in all camps, whether they're pro meds, not pro meds, on the fence with meds or not, will typically mention when they say, well, I've heard that this helps. So I think a good place to start is the supplements route, because every week there seems to be a new supplement that I see advertised, and it's a new power sort of concoction, and whether it was what they called mushroom, not magic mushrooms, what are they? There's mushrooms being advertised all over Instagram, and I can't remember. The people will know what I'm on about. A particular type of mushroom that apparently is amazing.
Lion's mane?
Lion's mane,
perhaps?
That's the one. Thank you. Yes, I knew it looked like it. So lion's mane was supposed to be the new big thing and seems to have vanished, right? There are lots and lots of supplements. There are some things that crop up in terms of vitamins and minerals that seem always to be recommended as well. So the one I hear, and I'll hold my hand up, I've challenged it and gone, but the only evidence I've seen is in relation to kids. Omega-3. Every day somebody says, if we take nothing else with ADHD, we should take an omega-3 supplement of some kind. Is that something you agree with? And if so, why? Okay.
I'm not going to answer that question, but I'm going to answer it more broadly. So omega-3 is an oil that we get from certain foods, oily fish principally, but there are other sources, and it's not as widely available in our diet as other nutrients. And there are lots of studies. So there are studies in schizophrenia as much as there are in ADHD that show that supplementing with omega-3 has an impact on brain function. By giving the brain what it needs to maintain itself, you see better brain function.
Right.
And that's what omega-3 is bringing, because it's not widely in our diet. And if you live in, let's say you're an Eskimo and you're pulling oily fish out of the ice every day, you're not going to need to take omega-3 because you've got oily fish coming out of the sea every day. And this is the case for a lot of supplements. This is, they are supplements. Why is it called a supplement? Because it's a supplement to your diet.
Right.
Yeah. So if there is a deficiency in your diet, supplementing it with a pill will help, because you're addressing that deficiency in nutrition.
Right.
So it's not that omega-3 is good for ADHD, it's good for brains.
Gotcha. Therefore, then, and not everyone can afford this, but I'm just saying, would the obvious answer be that's the job of a nutritionist? Go get tested. Nutritionist says you're deficient in X. Those are the things you take in a supplement, but knowing that they're not specific to ADHD, they're specific to you.
Yeah.
Because I think a lot of the time it's an article, it's a Facebook post or an Instagram or whatever, and it's that everyone, or if you've got ADHD, you need lion's mane or whatever. And I always look and go, how do you know? How do you know everyone will benefit? How do you know everyone with ADHD will benefit if they take this? That seems very broad to me. But I understand not everyone can afford a nutritional check or a Zoe app or whatever. But, that's the question, I suppose. Is it not a bit too much of a sweeping statement to say everyone? Something like omega-3 we know because there's research. Then.
Yeah. So omega-3 sits outside of that, but the others don't really, because largely things are available in our diet. There's quite a lot of magnesium in your diet, so long as you're eating a healthy, balanced diet. But magnesium supplementation, if it's not there, will help. I live in the north of England, and doctors say all of us should take vitamin D supplements. And probably it's true in the south as well. We live in a gloomy country that, it gets dark at 3:00 in the afternoon at this time of year. And we synthesize vitamin D by sunlight on our skin.
Yeah.
But when I go out in Newcastle, I'm not seeing everybody walking around with rickets. Yeah. Not all Geordies have rickets because it's dark up here, So there's an element of yes, it will have an impact if your diet is lacking, but what sort of an impact? I don't take a vitamin D supplement, but my legs are straight. It's about how much difference. So yes, it will make a difference. You can say it will make a difference because you're not quantifying how much difference is it going to make, and that's where these claims. You can say, this will do X, Y, or Z, but what's that actually bringing to the party? Yeah, my bone density might be slightly more dense in a sunnier country, but I'm not a massive wobbling jelly because I live in the northeast of England.
So are we going back to the point of expectations, and also that most of these will in some way have a placebo effect as well, because we believe it's doing something when we take it?
Absolutely. I wrote an essay on this once, and ask anyone about chocolate. Does chocolate boost your mood? So I did a full literature search on that, and no, it doesn't, apparently. But I know in my house there are certain points in the month where getting a bar of chocolate wins brownie points. It's
just a safety measure.
But that you see, it's about it being more than just the biology again, isn't it? There's more to it. All right. The biology of chocolate doesn't have any impact on mood, but I know when I bring that bar of chocolate in, that it's going to be met well and it's going to give a lift.
Right. Okay. Which then takes us a step forward from supplements to some of the other things. Right now, when we did this sort of the pilot, if you like, for this, and we spoke with Richard Peach here as a coach about other things to help boost mood, etc. It was interesting that he and I were quite, opposite ends of a scale. I use myself as more of a human guinea pig, and will try and eat once or twice to see if it has an effect, whereas he's kind of like, no. So, to put that in context, Richard is a big fan of model making and airfix and model railways, and he was saying that helps him on many, many levels. It means he can jump from project to project, he can dip in and out of things, but he can lose himself in painting a figure, and that makes him feel good. That's great. Yeah. If I tried to do that, I'd lose the brush, I'd knock the paint over, I'd go outside the lines, and I'd feel worse. What I do instead is get in a tub of cold water, or have a cold shower, or do something like that. Now, again, the interesting conversation around this, I think, is should any conversation about what people may want to look at be prefaced with this phrase of some people may get some benefit some of the time, rather than thou shalt all do yoga or paint models or go bungee jumping because it's the most dopamine intensive thing.
Oh, it is.
There a bit
having done one.
Can you believe it? I know.
Having done two, actually.
Right. But does that make sense to me? Because again,
totally.
I see these things of you should. Oh, well, if you do breath work and if you do Wim Hof method, you won't need medication for ADHD. No, you might feel that you don't. But I do both of those on a regular basis, and I still need medication. So which one of us is not right here? The answer is neither of us. Our experience of the same protocols are different. Just completely the same four letters, right? That always seems logical to me, and I say you agree, but you must have seen this as well, where it seems like it's dictum. Well, if you just do this. Is it not about personal choice, experimentation, I suppose keeping your own data to a degree?
So a wise man once ironically said to me, never give unsolicited advice. And I think there's a lot of advice out there which... I think if you go looking for it, then you're soliciting that advice, aren't you? You're looking for those answers. But actually, you're right. It's what works for you. I don't like getting in a cold swimming pool, and my sense of cold is very different to yours. I just don't like it. I'm very much in Richard's camp there. I was sat at 3:00 this morning, couldn't sleep, doing a jigsaw puzzle.
Yeah.
Because it shut my mind up so that I could just leave it all behind and get some rest, And it's about doing what works for you. So if as a Geordie you feel you need to take vitamin D so that you don't get rickets, then go for it. It's not going to do you any harm, but don't think it's going to be a panacea any more than methylphenidate is going to be a panacea. It's about what works for you at that time, and that can evolve and change as well. I might one day have a revelationary experience that a cold plunge is wonderful, but I'm not prepared to take that risk. Just like Richard, I'd sooner sit and do my jigsaw. But I recognise that it works for you, and you're not the only person that said that. It seems to do something for some people, and that's potentially about the expectation that you have. There's a physiological response to dropping that temperature, but it's about your experience of that and what that means for you, that means that you go beyond. And I think last week you talked about that apprehension of plunging, but actually the payback afterwards, it is worth it. And it's true of all these different advices. There's an endless amount of books you can buy. Jessica McCabe's just about to publish one, isn't she? And so everybody has their angle, but none of them are the only way of. There isn't one way of living with ADHD any more than there's one way of being a human. We've potentially over-medicalized ADHD so that we can get the benefit of medication when, there's more to the story than that.
Yeah.
Yeah.
Isn't it just? And I think that's why this discussion following on from the meds is so important. And you made this point earlier. When you think about it, anything that's not medication, we have to look at in a similar way to medication. We have to know what's our expectation before we start. Why have we got that expectation? And then when we try it, whatever it is, and we get an result, it's perhaps not being disappointed if it doesn't quite match up. It's about understanding why didn't it match up, or what's changed. Or, one of the things I say in mentoring all the time to my clients is, you may find something that you think works brilliantly, and it may, for 3 weeks, 3 months, and then one day you'll wake up, get out of bed, you'll do the same thing, and it'll have absolutely no effect, and you will have no idea why. Don't panic. Just know that that's time to try something else, and then go back to whatever it was at a later date. It's just something I've learned. Things don't, when I say, well, I've done this for a year, I could no more do the same thing religiously for a year, than I could become a nuclear physicist, because I don't have that habitual element in me. But I know that I can do several months of cold showers and then just for a fortnight think, what, I just don't fancy it. I don't need it. And I recognise that, and I know how differently I feel. It doesn't mean cold water has broken. It doesn't mean exercise has broken. It just means it's not doing the same thing now. In the same way that we said about taking a med, if you want a concentration day, take a med. If you want a creative day, perhaps don't. It's understanding that anything, whether it's something we put in our mouth, something we do, something we think about, there is no definitive. No one else can tell you what you will experience. They can give you an idea, and we started this podcast, and again, I'm as grateful for you doing it with me as I am to you, because I wanted to do this with you because of your background and you and Sarah's experience. But this thing about evidence and sort of trying to show the facts has been really important for me. And it comes back to, interestingly, the cold water one, right? As an example, I could go online now, if I go into my save files, and pull up pages and pages and pages and pages of research on why cold water is good for certain things. Not one of those pieces of research says anything about its efficacy for people with ADHD. Now, that's A, because there are no studies that have been done specifically on people with ADHD and cold water therapy yet, okay? And B, because I almost guarantee that everyone with ADHD will experience it as uniquely differently as everyone without. Because it doesn't help me concentrate, it doesn't help me focus. It does different things depending on how long I stay in the water, how cold the water is, whether I'm moving, whether I'm swimming, right? That's me, not my wife or someone else. And it's having the ability to see a bit broader. It's having the ability for me to say, I can look at the evidence from, say, Andrew Huberman's podcast that most people tend to refer to, or Wim Hof. It's still general. It's still a guide. It doesn't mean it does for everyone. And whatever we talk about, whatever we consider, and again, I'll go back to the coaching, mentoring, even counselling, therapy angle here. These should always be suggestions with the caveat of you have to research for yourself. You have to know yourself well enough, like you said, to know that you wouldn't want to get in cold water because you don't like it and that's the last thing you'd want to do. Fine, don't do it then. Yeah. No one can tell you you should. It will make you. It doesn't matter, right? But we have to have the I suppose the level of self-awareness to say, I see that, whatever it is, but do I want to take vitamin D? Need to take vitamin D?
There's another dimension as well, and that is that something can work for someone with ADHD. Yeah, so whether that be a non-medical or a medical intervention, and it can make them feel better. It can give them an improvement in how they are, whether that's in concentration or mood or whatever. And you could do a study on lots of people with ADHD, and they'd all see that improvement. But that doesn't mean that it's improving their ADHD. They're having their own improvement. So it's the question is, what can I do to improve my ADHD? That's the wrong question.
Mm-hmm.
The question is, how do I make my life better? I know my brain works like this, but there's so much more to me than my attention and my levels of activity. I'm a human being living in a world that has many beauties and many challenges. So just because something works for people who have ADHD doesn't mean that it is addressing their ADHD. But
right now that brings me on to this then, and I'm going to pronounce this wrong. L-tyrosine?
Okay.
Right now,
I knew you were going to raise this.
Well, only because I've been looking into this. Right, I've seen it. I understand. I think what it is.
So L-tyrosine is a precursor to dopamine. Yeah, so it's a building block.
Right.
Your body translates L-tyrosine into dopamine. But that doesn't mean it translates it into synaptic dopamine. Remember those graphs those animations last week? You can have that top cell that was full of all those little purple bubbles moving around. Remember those?
Yeah.
They can all sit in that cell, not released, and you could put loads of L-tyrosine in and fill those up. But if not enough is getting released into where we need it to be,
in the bottom,
then we're not going to see an improvement in attention. However, if you're deficient in your diet, in the things that sort of are synthesized into L-tyrosine, which then becomes dopamine, then there's going to be too few of those bubbles of pink dots. So by taking L-tyrosine, you're restocking. But remember that the cell is recycling. All ADHD medications, apart from guanfacine, are preventing the reuptake of dopamine. So there is a recycling process. It's not like you get one shot. It's not like petrol that you have to keep topping it up. There is a recycling and a reusing. Actually, I didn't point out on those animations last week, the yellow things sitting in the synapses are these molecules that break down the neurotransmitters, serotonin, noradrenaline, dopamine, into their constituent parts. And actually, you can take a bit of dopamine, take a bit off there, and make serotonin out of some of the bits of that. So it's not like if you take L-tyrosine, you are filling up your dopamine tank. That it's not just about I don't have enough dopamine in my system, therefore I have ADHD. We don't have enough dopamine in our synapses that sit between the brain cells in the prefrontal cortex and other bits of the brain as well. So by simply supplementing, you might address a deficiency in the building blocks of dopamine, but does that have a direct impact on ADHD? Only if you're malnourished, such that you don't have the ingredients to be able to create your own dopamine. So yeah, it potentially could offset some nutritional deficits, and would be helpful there. It's the same as, it's dropped out of my mind, tryptophan. Tryptophan is a precursor to serotonin. And you can actually prescribe tryptophan, but the evidence isn't as good for that as it is for antidepressants. And it's the same with L-tyrosine. Yes, if there's a deficiency, supplementing it will help, just as much as me taking vitamin D will increase my bone density because I live in the Northeast. But that doesn't mean it's going to address my ADHD.
I'm scratching my head again because I'm trying to think how best to phrase this question then.
Well, I know it's going to be a beauty then.
Right, based on what you've just said, okay, whether it's L-tyrosine or anything else, vitamin D, we're talking about if we're deficient.
Yeah.
If the diet means we're deficient in it, right? That's what we're saying. I suppose the question I can almost hear people asking if they're watching or listening is, how would I know? How would I know if I was deficient, let's say, in L-tyrosine? Now, is that why perhaps there's a market of products saying, well, it's quote unquote known to have effects here and here, so take it anyway, better to take it than not? That seems a bit, I don't know. Again, I'm choosing my words really carefully.
Is there anything wrong in supplementing vitamins and minerals? No. If your body doesn't use that, I mean, you can take excessive doses of vitamin C and give yourself all sorts of cardiovascular problems over long term.
Sure.
But you know, if you take the recommended daily amount of whatever vitamin or mineral, then you're ensuring that you've had that intake. But you're not thinking about how much is in the food that you're eating. So you're buying those nutrients twice and discarding half of it, throwing half of it away. Potentially, as long as you're eating a balanced diet. It's only if you're not eating a balanced diet that you need to supplement.
The advice would then be, before you invest in the supplement, look at your diet. Look at where you can find naturally occurring the L-tyrosine, whatever. Is it likely to be in your diet in enough amounts? And if you think not, as we said, depending on culture, etc., then yes, maybe a supplement makes sense. But it's not a blanket always for everyone again.
Yeah. It's not putting petrol in the tank. I think we need to move beyond and evolve from this understanding of low dopamine. Where is the dopamine low, and does that mean that it's low across the board? No, it doesn't. It means that it's not being secreted where it needs to be, and it's held in other places often. But equally, it could be that there isn't enough. But usually, it's because there's not enough of it where we want it to be.
Gotcha. Now, there is, and I'm sure this will be a discussion in its own right in full, but something has just occurred to me. I'm thinking about lots of these things and the packaging I see, and some of the others. So again, I'll go back to exercise or cold water or things that bring you pleasure. Now, a lot of the reason people do these is because what they seem to be doing is help us manage our anxiety, manage our stress, for example. And we've mentioned that, you know, there's the trauma part of growing up with ADHD, that, you know, it does cause trauma, but there's also that stress and the fact that so many of us live with comorbid anxiety or anxiety disorders. Do you think that the reason people link lots of things together and say this helps my ADHD is actually because what they're doing more is helping stabilize anxiety, and therefore when we're less anxious, we're more able to feel in control of everything else as well?
Control is key, isn't it? It's absolutely key, because so often in our lives before diagnosis, we're not in control, we're being criticized. So putting that control back, that sense of I am doing something. We talked last week about the placebo effect. Like we use the term placebo effect like it's some kind of a problem that it's a confounding issue, and it's not. It's a function. It's a human response to expectations, isn't it? And if we have a sense of control and purpose in our life, and choice, the things feel better.
Gotcha.
So yeah, you choose to plunge in a cold pool. I choose to sit at 3 o'clock in the morning doing a Star Wars jigsaw. And I didn't get wound up at 3 o'clock this morning that I wasn't asleep and that I'd be tired today. No. I was doing what I needed to do to manage the flurry of thoughts that were going on in my mind. And that is the key, isn't it? It's about finding what works for you. And yes, there's a whole buffet of choice, and it might not work for you today. The big one is organization apps, isn't it? You can buy any number of apps that will deal with your executive dysfunction. Well, it'll only deal with it if you use the app. And I tried them all. You only get out what you put into computer systems, and they work for a bit, and that helps. But the novelty dies off, and then you don't sustain it. And it's about your journey as much. It's my journey and finding that the way that I organize myself so that I don't fall over my own feet because of my own disorganization. That's an ongoing project, and we all have those ongoing projects, and we try things, and some of them work for a bit, and some of them don't work, and some things work for forever more. And I swear by that. But those things are different for everyone.
And I think that really is the theme of this discussion, as well as to a degree last week. The theme of this is you've got to do your own experimentation. What works for you might not work for someone else. So it's okay to see online someone saying this worked for me. You have to take that with the understanding or the expectation that it might not work for you. You can choose to try it. You can choose to put your time, your effort, your money even into it, but you have to go into it open-eyed, going, I am not the person sat there saying this worked for me, therefore I am me. And if it doesn't work, it doesn't mean you're broken. It doesn't mean you're worse than. It means that doesn't work for you. Go find something else. And it might be a constant experimentation, mightn't it?
Well, it might be. It's like looking for a job, isn't it? You apply for a job, you get knocked back, you go to an interview, you don't get the job, and then one day you get the job, you're not looking for a job anymore.
Yeah.
So when you find something that works for you, you stick with it.
Yeah.
And you don't have to look anymore until that doesn't work for you anymore. And then when the job's getting on your nerves, you apply for a range of different jobs and you get another one. You might not get the first one you apply for, but so, this idea that there are interventions for ADHD is too reductionist. There are ways of being a person. And when you're looking for some support with your ADHD, it's a good idea to look for support from someone who understands how your brain works, because it is different than the typical. So people will often say, I want CBT. How do I find a CBT therapist that understands my ADHD? Because if you've got one that doesn't understand your ADHD, your therapist and yourself are going to clash, because they're going to be asking you to do things that your brain can't do, or will do differently. And it's finding what's right for you and listening to those cues.
There's the word. It's listening to the cues and listening to them. And I think it comes back to the coaching and mentoring again as well. If somebody's going to choose a coach and mentor, the way I would approach it personally, even now, is I would look for someone who has got a similar experience of life to me, who can understand everything I've gone through. So, maybe they're a parent as well. Maybe they're in a marriage as well. Maybe they're a similar age as me. I think it's very important that you look at the person beyond. I used to be a magician. I will finish and then let you close, but I'll finish with this analogy, right? I was a magician for years. And there was a running joke amongst all magicians that everyone was an award-winning magician on their website. That's all they ever said, award-winning magician. And the joke was, yeah, they were all your 10-meter swimming certificates, but nobody asked to know. Right? What does award-winning mean? What does experience mean? It means different things to different people. And the only way you'll know if the person you're choosing to work with to help you has the experience and the ability that's relevant to you is to ask them. Ask for them to tell them what have you done before? How many people have you worked with? What results have you had? Right? You've got to see beyond the magic term, smoke and mirrors sometimes again, and everyone can do it, but we have to be cautious because it's our mental health, well-being, expectations, everything that we are handing over to someone. And often money. And money, yeah. And that's responsibility, right? There's a lot of responsibility in that. So, yeah, that's. I think for me, that's where I would wrap that up is as a mentor, as that to say, ask questions. Like this podcast, ask for evidence. And if I think that is that. Look for something else.
Yeah, that extends across all interventions. It's not just about coaching and mentoring. It's about the psychological therapies. It's about an ADHD prescriber. Ask those questions. Get a sense of who that person is. Are they going to listen? You said it earlier. 90% of it is listening. If you're feeling like you're not being heard, then do you think it's going to change when you've paid a fee?
Yeah, absolutely. Yeah. Better to make that decision before you hand over the card.
I think another important thing you said was and you probably didn't register it, but the awareness that you can get things wrong. Someone being able to say, yeah, I made a mistake there. I got that wrong. I misunderstood what you were saying and I've gone down the wrong road. Being big enough to not have all the answers, I think is often a lot better than having endless letters after your name and professor this and doctor that. That's a standardized measure, just like a coaching qualification. It is what it is, and it is defined by what someone did to get that qualification or that registration. CQC registration is enormously complex. It took me a year to get the CQC registration in place and get everything in the company right to meet those standards. And some of those standards we've never yet hit the need for those things in place, but they're there. And when you see CQC registered on a healthcare provider or a social care provider, you know that they've met those standards. Just like when you see doctor, you know that they've done a course of study. And it's a bit different in the world of psychological therapies, coaching and mentoring. But the qualifications are there, and qualifications aren't just about certificates; they're about experience.
Yeah. I absolutely agree.
The fact that people come back to you speaks volumes about that. There's something about that experience and that human connection.
Yeah, I'd like to.
We don't reduce ADHD to 4 letters and a diagnostic formulation. That actually it's a shortcut to describe a lifelong experience.
Yeah, and it doesn't define us. We've said this privately and in conversations, and it bears saying now. ADHD doesn't define us; it describes some of the things that make us who we are. Right? You are not your ADHD. Your ADHD is a piece of you. But there's so much more to all of us. And I think it's so easy to get caught up in letting ADHD define you. And a lot of this conversation about the other is finding the things that help you remember you are so much more than just your ADHD. It's not to take away from the challenges, but it's also not to discount your abilities as well. It's not to discount the things that maybe it's enabled you to seek or to enjoy. So we are not our ADHD. is very important, I think, for me.
Absolutely. I think your story about your son today really hammers that home.
Yeah.
You know, he's capitalised on his strengths and has done something that the rest of us wouldn't even begin to think about doing.
Yeah.
Build on your strengths.
Yeah, within hours as well. Totally. Right, now listen, before we wrap up, we said we would do this every week, which was we would try and humanise this ADHD stuff. So while we're on this subject, I asked you last week what sort of defines you by your ADHD, and you mentioned forgetting things, leaving things. So I was thinking about this while I was looking at episode 1, and actually I'd forgotten how much that had been a part of my previous career, the forgetting things, but typically in a really spectacular way. So I'll briefly share this. I used to teach circus skills as a profession. Don't ask how I got here. Part of my job was having a big transit van full of a fleet of unicycles and tight ropes and various other equipment, but I performed as a jester, and I had series of props that were my high value, need them every job props. And I got booked in, I think it was St Albans, to do St George's Year Parade, and I did it 3 years running. On the first year, as I was packing up, I had a habit of, if it was important, I put it on the roof of my van, so it would go in the van last. That was the plan. And the duration from the car park of the venue to the M1 was about 1.5 miles, but it was all 20, 30 miles an hour. So I'd load up the van, drive off, and I distinctly remember accelerating down the ramp to join the motorway and seeing cars in my wing mirrors braking really sharply and thinking, that's weird. Why are they braking there? And then noticing 12 big, and when I say big, I mean 4-foot diameter hula hoops made from water pipe going trundling off down the motorway. And at that point, I thought, hey, I'm not stopping for that. They're gone, and just was pleased nothing had happened. I thought that's just my ADHD getting in the way, which would have been fine had I not gone to the same venue the year after and had a different high value prop that went on the roof. It's just unfortunate that this time they were juggling axes that were double bladed, sort of executioner style axes, had a 2-foot long solid wooden handle and looked vicious. And they stayed on the roof until I accelerated off the off ramp. And the same thing happened, apart from this time it was met with a cacophony of horns and screeching of tyres. And I didn't even look in the wing mirrors because I knew something was there. I couldn't remember what it was. And it's only when I got home and I was unpacking the van to go to another gig that I'd said, oh yeah, I've got these great axes for. And as I went through the van, I went, oh crap, that I realised that somebody had got the rudest awakening on the off-ramp of the M1 from St Albans. So yeah, ADHD and lack of attention and inattention and just moving at pace. I don't know whether I hurt anyone, if it caused an accident. I never saw anything on the news, but those kind of things stay with me to the point now, whenever I get in the car, and I stole this from the Holderness family, you can look them up on YouTube because I love this. If you are that kind of a person and you leave things on the roof of your car or you forget them in the car, change the words to the nursery rhyme, heads, shoulders, knees and toes, and change it to keys, wallet, glasses, phone, because it works every time. Have a little sweep on the roof, have a sweep under the seats, keys, wallet, glasses, phone. I haven't forgotten anything since. So I'll just leave you with that because that's been my saving grace. So thank you, Penn Holderness, for that.
Two thoughts there. It's the Blues Brothers testicles, spectacles, testicles, wallet, and watch, isn't it?
It really is. It really is. Yeah.
And the other thought I had as you were telling that story, wasn't it kind of ADHD to give you the softer hula hoop experience of the year before you had to deal with the axes? Because that would have been a difficult conversation with the police if you pulled over in a panic.
Yeah, I tell you what. Yeah, that's why I didn't, because that's what went through my head was there's no explanation for this. There's nothing to say, so I'm going to carry on, and that's what insurance is for. But it's terrible. It's just, yeah, it's one of those wonderful things. But fortunately, I sit in front of my desk all day, every day now, so I can lose far less. Listen, Andrew, I think from my point of view, we've covered an awful lot of ground again. I will say this to everyone that listens. You tell us, what are the soft skills you've employed? What are the alternate things you have done that have worked for you? Share it with us. Feel free to reach out, and you can join the community however you wish to do it, on WhatsApp and even Discord, I think, now as well. But what works for you? Because sharing is really useful in this world of ADHD. It's not to say it will work, but it might lead someone to trying something they've never thought of. So please comment on this. And I will say this, please do download the podcast, do subscribe to the podcast wherever you choose to listen to it. The same on YouTube. Ring the notification bell and subscribe, because it really does all help. Both Andrew and I want this podcast to grow so we can keep making videos and keep delivering this kind of information for you. So yeah, we welcome your comments and your contributions as well. And Andrew, anything from you before we say goodbye?
Nothing comes to mind, which is often the case, isn't it?
Yeah, we'll press stop and I'll go, one more thing. Yeah, true Columbo style. Well, listen, folks, We will see you again next Thursday. Again, this episode will be out this coming Thursday, so keep your eye on that. But for now, this has been episode 2 of Talk ADHD. Thank you very, very much, and we really hope it's helped you. See you again very soon.
Thanks, bye-bye.